Dr. Tom Abell is the Shane Chair of Gastroenterology at the University of Louisville, and he's the director of a GI clinic at Jewish Hospital. And he's doing research on using electrical stimulation to solve some chronic gastric issues. So we're going to talk about stomach problems, right, Tom?
You bet.
All right. Well, Dr. Abell, thanks for being with us. I appreciate it.
My pleasure.
All right. Well, let's talk a little bit about what problems do those of us who are humans have with gastro issues, nationwide, and what is the problem that you run across in your practice?
Well, people have lots of problems, as you know, swallowing, digesting food, moving their bowels, lots of problems. The particular one that we focused on a lot recently are people that have chronic nausea and vomiting, which is not a fun, popular topic to talk about, but in the human experience, everybody at some point has been nauseated or vomited. Mm-hmm. It can be from a viral illness, can be medication, surgery, can be any number of things. And usually it's a short-lived event. It's unpleasant, and we quickly forget unpleasant things. But some people have that chronically.
Wow. How many people have that chronic?
Probably at least 5 million people in the United States.
Wow. So you're talking 5 million people are vomiting. Is that like on a daily basis?
It depends, but many of them feel like they're going to vomit. We call it nausea. Uh-huh. But a lot of them do vomit daily or almost daily.
Wow.
So some vomit in cycles, which can be related to disorders like migraine, which affects up to 25% of the population. Migraine does.
Right.
And it's a rare complication of that. But those people are, as you imagine, pretty miserable. They can't eat a normal diet. Ironically, they actually kind of gain weight because they can only eat carbohydrates, so they end up eating chips and things, sodas, just to stay alive.
Right.
So they're miserable. And unfortunately, just changing the diet often doesn't take care of it. Mm-hmm. And there's only one medication approved in the United States for this, and it's not a medicine that can be taken safely long term. So there's not a lot of options.
But is that the first thing most doctors do? If I walk in and say, "Man, I've been throwing up for the last month and a half, and I don't get it," and they decide I'm chronic, the first thing they say is, "Well, we need to change your diet," and then they work towards medication, or how does that work?
Right. That's the usual approach, right? And
okay.
And in the past, people thought that these were, quote, psychosomatic because those people are oftentimes quite anxious and depressed, but it oftentimes we've discovered secondary to being sick.
Wow.
You imagine trying to live that way every day. And
no, I can't imagine trying to live that way.
So much of our social life revolves around eating. If you can't eat, you can't participate, and you become isolated and kind of withdrawn. So it's not a fun topic, but there are lots of patients everywhere, and a lot in this part of the country, in Kentuckiana.
Right. All right. We're talking with Dr. Tom Abell, who's a gastroenterologist at the University of Louisville and runs a GI clinic at Jewish Hospital as well. So if you're looking at these chronic problems, and it's called what? Gastro something paresis? Is that
that's one term, which literally means paralyzed stomach.
Paralyzed stomach. Okay. And so you've got that problem. You're vomiting on a routine basis. Nothing works. Diet doesn't work. Medicine doesn't work. That one drug that you got that you talked about doesn't work. What's next?
Well, what we hope people will do next is try to contact us, and we work a lot with primary care physicians and try to suggest what to do. And then if their patient's still not better, person's still not better, we're happy to see them. We get about 1,000 referrals a year, and sometimes it's discouraging for the patients because it can be a long time before we see them. But we also have other things we can do, other newer drugs that we're trying. We have through the University of Louisville, we're connected with the National Institute of Health and a protocol. And we also, for people that fail everything, we have a technique called electrical stimulation.
Right. That's what I want to talk about, which is really interesting. So describe, when you talk about electrical stimulation of the stomach, essentially, what does that involve? What is it?
Well, it's a technique that was developed originally about 25 years ago on a team that I was at down in Memphis, University of Tennessee in Memphis. And it was first tried in an animal model and realized it might help some of these patients. The way we do it is a little bit different than the approved way. We try at first a so-called try before you buy and use an endoscope lighted to put down a couple of electrodes, run them through
inside your
stomach,
guts.
and the inside
Okay.
stomach, run a couple wires, currently with a couple wires through an external device, and we try that for about a week and see if the person gets better. And if they do, then we have a permanent device that's put in surgically by our surgical colleagues.
How does electricity help with your stomach?
Well, I think what happens is that when you get normally vomiting is a normal reflex. If you eat the wrong thing and you get food poisoning or something, it's a normal reflex.
Mm-hmm.
It's abnormal when it's chronic, and it involves neural pathways, just like with seizures in the brain or cardiac arrhythmias in the heart. Everybody's familiar with that. It's similar with the stomach. You get electrical dysfunction, and so the electrical stimulation can kind of normalize that disordered function.
So it's kind of like having a defibrillator or something like that in your heart, or a...
Yeah, and some people have heard of what's used for Parkinson's disease, the tremor. It's an implant in the brain that actually won the Nobel Prize a couple of years ago. It's similar to that. It uses low dose of energy, and I view it in my simplistic way as kind of tickling the nerves, getting them to settle down and smile instead of frown.
And this is called a gastric electrical stimulation, GES, right?
Right, that's the term.
How many folks have that? How many folks actually have something implanted in their stomach?
Well, there are probably well over 10,000 people in the world now. We do a lot here in Kentucky. We do about 10% of the world's implants here, so we see people from all over. But it's a technique that we reserve only for those people that fail everything else. But for those people, it has the potential to get them to eat more normally, hopefully not having to use tubes or IVs to stay alive.
So it's a last-ditch kind of thing for folks who are having this chronic vomiting and problems. Does it work? Obviously, it works, or you wouldn't be implanting it, but does it completely cure the problem, or does it just make life better for these folks?
Generally, it makes life better. It's these disorders, the most common cause that's recognized is diabetes, and we know the people that have diabetes have neuropathies, so it's a kind of diabetic neuropathy. But the non-diabetics also have neuropathies. That's part of the work that's come out of our National Institute of Health work.
Okay.
Almost 100% of these people have disordered anatomy, so something's not right.
Right. All right. Well, something I wanted to ask you about. We only got about 2 minutes left here,
Sure.
but I want to get to you since I've got a gastroenterologist sitting in front of me here. What are some of the things that you're seeing more of in your practice with the eating habits of folks and environmental hazards we've talked about on this show before? What are some of the things that have kind of popped up maybe in the last 10 years in terms of gastro problems for Americans and folks living in Louisville?
Well, it's a big topic. A lot of that relates to another large issue, which is being overweight, which we all realize is not good. And that has a downside in just about every angle, from cancer to heartburn to. But that's probably driving a lot of what we see. We now, as we learn more, we realize that the bacterial and viral content of the gut's called the microbiome is influenced by diet, and that's probably the new frontier, is to understand that.
Yeah, we've had a couple guests on our show to talk about that, about the gut bacteria and the role it plays, and actually your in total health well-being, not just what's in your gastrointestinal tract.
And the old phrase "you are what you eat" is maybe brought home by that.
Yeah,
we realize a lot of chronic illnesses. Again, I talked about Parkinson's earlier, but Parkinson's actually may begin in the gut and then later shows up in the brain.
Wow, really? I hadn't heard that one. That's interesting.
Some of our patients with Parkinson's, for example, will be constipated for decades and then later develop the illness. So that's the nice thing about learning about this is we have the potential to intervene earlier. Right. And hopefully prevent people having to come to us late stage and needing.
Right, and UofL is doing a lot of research on these very important topics. True. Dr. Tom Abell, appreciate you being on the show.
My pleasure.